On this episode, we'll talk about symptoms of a leak. We'll also talk about having a gastric sleeve after a hysterectomy, and we'll talk about problems with your teeth after weight loss surgery. Hello everyone, I'm Dr. Alvarez with Endobariatric.com, and welcome to episode 116 of the AskDrA show. Thanks so much for submitting questions. Two ways to get your questions to me, hashtag AskDrA, and through my Snapchat account. Let's go to the show.
What are the symptoms of a sleeve leak?
All right, so since you are not a doctor and you don't need to know exactly how to make a correct diagnosis of a leak, what I need to tell you is that every day after a sleeve, every day you should feel a little bit better. A bit better and a bit better. If you feel worse and worse and worse, and you feel something is wrong and you have some symptoms like fever, like intense abdominal pain, nausea and vomiting that doesn't stop, difficulty breathing, low urinary output, stuff like that, it's just a red flag. I mean, something's wrong. So all you have to do is contact your surgeon. Your surgeon, please do not be posting on a board and see if someone knows about this and maybe they have similar symptoms that maybe they may have a urinary infection with fever and you're thinking you're having the same thing. No, please contact your surgeon or her practice because this needs medical attention. So all you need to know is every day you feel a little bit better, all right? Now, chances of a leak, and we've said it before, nowadays are close to less than 1%. With a good surgical technique, with the type of materials that we're using nowadays, the tri-staple technology, the staples that adapt to your stomach thickness, and all this that combines, it gives better outcomes, lower rates of leaks. But surgical technique is very, very important.
Can I have weight loss surgery after years of having hysterectomy?
Yeah, so on this question, we intentionally added this particular question that says hysterectomy. But what we normally see in a day-to-day basis here in the office is patients ask me, well, I've had 6 C-sections, I've had 3 C-sections, I've had a hysterectomy, I've had a colon resection, I've had all these surgeries that are in the pelvic area, and the message is they do not interfere at all for having gastric sleeve surgery. It is very important for you to mention this to your doctor, mention this to your surgeon, because they need to know what type of manipulation was done inside your abdomen. But they do not interfere at all having weight loss surgery.
After surgery, my teeth were very sensitive. Is this normal?
All right, so sensitivity, teeth sensitivity, normal, expected, yeah, sometimes seen. But I don't want to generalize here because problems with your teeth are very, very common with other types of procedures away from the gastric sleeve. Talking about duodenal switch, talking about gastric bypass patients, patients that have dumping, and these types of patients also have problems with the calcium. It's easier for the teeth to be chipped off and to be have fractures down the road, and to become to have decay and to have cavities. That does not happen normally with a gastric sleeve patient. Remember that the gastric sleeve, we don't mess around with the intestines, you don't have the malabsorption, and you don't have those issues. But let's now back off a bit and generalize. What can you do to prevent problems with your teeth? Well, number one, you take your supplements. Take the supplements your doctor is recommending. Supplements are very important, okay? Also, if you do have vomiting or let's say back to the lap band era, where patients with a lap band used to throw up a lot. Well, those patients that would be vomiting a lot would have a lot of gastric acid, gastric juices come up and would start to damage teeth, gums, etc. Nowadays, patients with a sleeve are not patients that throw up frequently at all. Also, backing off to the gastric bypass. Patients with gastric bypass have dumping. And patients who have dumping have a lot of issues and trigger sometimes nausea and vomiting that may affect teeth or gums, including sensitivity, decay, cavities, etc. So, number one, treat your heartburn, treat your vomiting in case you're vomiting, take your multivitamins, and follow your doctor's guidelines. Normally, this is not a condition that is seen in gastric sleeve patients. It is more commonly seen in other types of procedures. Take your supplements and, well, visit your dentist. All right, there you go. That's it for episode 116 of the Ask Dr. A show. Question of the week is, did you have any teeth problems? Anything whatsoever? Gums, teeth after weight loss surgery? Comments down below. I'm Dr. Alvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless. Bye-bye.